have a septum in the middle of my uterus. With all the things I've done, like with the IVF and trying to freeze my eggs and embryos and stuff like that, no one's ever told me.
I often see uterine anomalies get missed or misdiagnosed. This is why I dedicated a whole chapter of my book to explaining the different types. The correct diagnosis is key to knowing your risks and treatment options. Uterine septum is one of the most common congenital anomalies that can affect the uterus, and it is not that common overall in the general population. About 0.5% to 2% of women overall will have a uterine septum, but 15% of women with recurrent pregnancy loss are found to have a uterine septum. When we're a fetus in our mother's womb, the way our uterus forms is essentially from two ducts that come up and fuse together. And then there's a resorption phase of the wall that forms between the two ducts fusing. And when that resorption phase is for some reason interrupted, you end up with this remnant called a uterine septum. And the issue with a septum is that it's taking up space in the uterine cavity. It's fibrous tissue. It doesn't have good blood supply. And therefore it's presenting extra surface area where an embryo may implant and then not have adequate blood supply. And this can lead to problems like first trimester miscarriages. Having a septum can also put you at higher risk of problems like preterm labor, breech presentation of the fetus at time of delivery, and problems with the placenta causing growth issues. However, it's important to remember that many people with a septum can go on to have healthy full-term deliveries because there is still plenty of surface area on the side walls of the uterus where there isn't a septum that an embryo could implant successfully. Now, you may be wondering, how could this go unnoticed after someone's had so many standard pelvic ultrasounds? Standard ultrasound, you're getting a side view of the uterus where you're looking at the lining of the uterine cavity. Uterus is a collapsed cavity, and unless you fill it with fluid and expand the walls away from each other, sometimes things like a septum can be hidden, especially with this view. If you do a 3D ultrasound with a regular pelvic sonogram, then it can become a lot more clear because you're getting this head-on view, and this is what a normal uterine cavity looks like. This is called arcuate, where there's a slight indentation, but here you clearly can see a septum where you have this triangular-shaped indentation dividing the cavity in half. In general, 3D ultrasound is not used routinely when you're doing regular monitoring visits, but typically at that first baseline scan, if I'm sweeping through with that side profile view and I see something suspicious that looks like it could be a septum, I will do a 3D ultrasound to try to get a head-on view. Doing a saline sonogram where you instill saline solution into the uterine cavity to push the walls apart and get a 3D view is really the best way to understand if someone has a septum or not. But you can also look on HSG to look at the inner contour of the uterine cavity, and this shows you very clearly a septum. The downside of an HSG, which is basically just showing you a silhouette based on the X-ray view of the pelvic cavity, is that you can't see the outer contour, and so you can't really tell a septum from a bicornuate uterus where you actually have two different uterine horns. In cases where we can't get very clear definitive views on ultrasound, which can sometimes happen, we'll send patients for a pelvic MRI where you can get a very clear view of the inner cavity and the outer contour of the muscle part of the uterus.